We are thrilled to be here with you today to celebrate the uniquely qualified class of 2020. Having finished their coursework, our graduates have worked hard and are well prepared to embark upon their journeys into the dynamic field of public health. To kickstart this celebration, please welcome Cheryl Healton, Dean of the NYU School of Global Public Health.
Welcome, everyone. It's wonderful to see your faces after so long apart from one another. I miss seeing you, and I hope that you are all safe and well. In my role as Dean of the School of Global Public Health, I speak today to you on behalf of the faculty and the administration to say how proud we are of your accomplishments in this extraordinary time. We celebrate your achievements today and also your remarkable adaptability in this last semester. That adaptability will serve you well as you embark on the next phase of your careers. We have many sayings at NYU GPH. The first you will no doubt be familiar with, reinventing the public health paradigm. COVID-19 has exposed just how badly the public health infrastructure in this nation must be rethought and innovated. Some of you will no doubt become the new architects of that reinvented infrastructure. Others among you may become frontline workers in public health by overseeing contact tracing, testing, planning for the next pandemic, and ensuring our public health system at every level is modernized and fully capable of successfully preventing and responding to the next epidemic. You've also often heard me say that public health is more than a career. It's a calling to save lives for a living. You've watched the courageous public health workers and healthcare providers on the front lines of this battle, putting their personal health and safety as well as that of their loved ones at risk every day to selflessly save the lives of others. Thank you for answering the call to join the public health profession at this historic time and for coming to NYU to prepare yourselves for it. Finally, I'll leave you with another saying I admire. Smooth seas never made a skilled sailor. This global pandemic has shown you firsthand how turbulent and catastrophic a public health emergency can be. The lessons from it will stay with you for the rest of your lives. The pandemic underscores just how bold and important the decision was 5 years ago by NYU's Board of Trustees and leadership to establish a School of Global Public Health. It is now my privilege as your dean to introduce our next speaker, an ardent supporter of our school, the president of New York University, Dr. Andy Hamilton.
Thank you, Dean Healton. I'm delighted to say a few words to the outstanding School of Global Public Health community. Class of 2020, I know that this is not the way we hope to celebrate this milestone in your lives. But although our format today is virtual, our pride in you could not be more real. You have met the challenges of the past semester with forbearance and resourcefulness, and you have completed a rigorous course of study at one of the top-ranked schools of public health in the nation. Now you are poised to launch your careers in the midst of the global fight against COVID-19. Your hard-earned skills are needed now more than ever. Your graduation keynote speaker this year is a terrific role model for you in these unprecedented times. He has dedicated his career to protecting the health of all Americans. But in his current role, he works to safeguard the lives of New York City's 8.5 million residents, especially its most vulnerable populations. As Deputy Mayor for Health and Human Services, Dr. Raul Perea-Henze oversees 11 agencies and mayoral offices. These include New York City's Department of Health and its system of hospitals and other healthcare facilities, home to many of the courageous healthcare workers on the front lines of the coronavirus fight in this great city. So please join me in a warm NYU welcome, along with our unceasing gratitude to Deputy Mayor Perea-Henze.
Thank you, President Hamilton, for the warm introduction. I am honored to have this opportunity to address the 365 of you graduating from the School of Global Public Health today at this extraordinary time. On behalf of the City of New York, I congratulate you on this achievement and thank you for choosing to serve in public health careers. Your choice is one of the most important and visible things anyone could do to help millions of people right now. Your contributions are going to shape our city and the world for decades to come. More than half of you are international students or from underrepresented communities. You come from more than 40 countries and speak 39 different languages. You are truly a class of global public health professionals. As you have learned during your time at NYU, New York is a global city, and what happens around the world has an impact on public health here, and what happens in New York City affects the world. 8.6 million New Yorkers are grateful to you for choosing to serve. I also want to recognize all the family members, loved ones, and friends who help you get you where you are today. No matter where your journey in life takes you, always remember the support and sacrifices of those who help you. Never lose touch with where you come from. When I accepted the honor to be your keynote speaker, I could not anticipate it that I would be delivering this speech virtually and not in person with you today. So much has changed in a short time, and we are all struggling to make sense of it, grappling to understand the profound shifts underway so that we can act to make things better for the communities we serve. We don't have all the answers right now, far from it. We are learning new things about a new disease and its fallout every day. The road ahead is going to be long, difficult, and at many points unpredictable. What I do know for sure is that you all will be integral to our recovery, and the world needs you right now. As you begin this journey at this challenging time, I want to talk to you about the importance of resilience, both professionally and personally. I'd like to share what I have learned from 3 decades on the front lines of global public health, so that it might help you find the most happiness in your careers and lives. Here is what I know. Being a resilient professional and person takes 3 things. Recognize that crisis presents opportunity and embrace the challenge as a gift to grow. Understand that some of the most important lessons are not learned in books, and adapt to the situation. Stay true to yourself and look for happiness in your mission of saving lives. I will spend a few moments now on each of these points from my own experience. Growing up in Mexico, the son of health professionals, I knew from the time I was a teenager that I wanted to be a doctor. When I finished medical school, I hoped to work for the World Health Organization, but before I could make my way to Geneva, my first stop was in New York City, working for the Health and Hospitals Corporation and at Kings County Hospital. I soon found myself on the front lines of the AIDS crisis at the epicenter of the epidemic. One of my assignments was to work with the city's Department of Mental Health and nonprofit groups to decide how to allocate funding from the Ryan-White CARE Act. This wasn't what I had planned for, but it gave me opportunities and insights from the front lines that have shaped and sustained me ever since. In the end, working for the city of New York was just like working for the world, only more than I could have ever imagined. This shows that you can't plan everything about your career. In fact, you can't plan most of it. You need to be ready for anything, and you will be defined not by what happens to you, but by how you respond to it. Just as my generation was presented with the AIDS crisis, your generation faces the challenge of COVID-19. It's been 100 years since the world has seen a pandemic like this, and now this is your turn. I extend my condolences to all who have been lost and struggle with this disease, and I salute our brave frontline workers and public health professionals whose ranks you are now joining. From the courage of first responders to the stark disparities and impact, COVID-19 exposes the strengths and weaknesses of our current public health infrastructures. Here in New York City, we are at the epicenter of the epicenter. Communities of color are dying at rates disproportionate to their representation in the population. The disease preys on pre-existing conditions that disproportionately burden the neediest communities, from chronic diseases to overcrowded housing. We are not just facing a public health emergency, but a social crisis. The unemployment rate in this country stands at nearly 15%, the worst since the Great Depression. Routines have been upended, and social isolation holds potentially far-reaching implications for mental health and our civic fabric. Like past public health crises, some have responded by trying to blame immigrants and marginalized groups as if somehow this were all the fault of our most vulnerable neighbors. As I said earlier, crisis presents opportunities. Resilience means approaching the challenge as a gift, the chance to grow as a professional and as a person. As graduates of NYU School of Global Public Health, you have been uniquely trained to imagine how we can reinvent the public health paradigm. The COVID-19 crisis compels us to reimagine public health systems to better safeguard future populations from the next outbreak. You were made for this moment. This is your time. In the next 1 to 2 years, we will need to laser focus on health equity in the following ways and more. We have to reinforce the health of our hospital system, especially public hospitals and safety nets. We must continue to fight chronic diseases that predispose COVID patients to poor outcomes. We need guaranteed health care for all, regardless of immigration status or ability to pay. The de Blasio administration already started this work with NYC Care in Bronx, Brooklyn, and Staten Island. Now you are the architects of the better future that we need to build. The AIDS crisis and COVID-19 show that public health professionals need to be prepared for anything. You may be asking yourself, how can I prepare for the unknown? What is the most useful among everything I just learned in my program? Well, put down your books. Some of the most important lessons you need for this fast-moving and unpredictable world cannot be learned that way. The public health profession has changed rapidly since I received my training at Yale. My own career has moved from performing 500 deliveries in a year in an underserved area in northern Mexico to global health with the pharmaceutical industry, or working with homeless veterans, and ultimately being the CFO at the Commerce Department in the Clinton administration. There was no blueprint I could study for these situations. In fact, if I had followed dogma rather than being open to the reality on the ground, I would have not arrived at the best solutions for the communities I've served. This goes to show that resilience is about being able to adapt to any situation. What matters today more than ever in the public health profession, or any field really, is critical and strategic thinking, flexibility, and creativity. You are well positioned for the present moment. You are graduates of a school anchored in innovation and entrepreneurship in New York City, one of the greatest living laboratories of public health education in the world. Right now, leaders are wrestling with big questions that move beyond traditional public health areas and look at all the different factors that go into taking care of a community. Here in New York City, we've had to ask, how do you get millions of supplies like PPE, face shields, gowns, and ventilators to high-need areas when there is not enough available? The answer is we made our own, using local firms to help keep New Yorkers employed and protect our frontline workers. We've asked, how do you deliver millions of meals to communities that are suddenly food insecure because of the pandemic? The answer is you tap into the vast distribution network of our departments of education and sanitation and convert a fleet of taxi drivers into a food delivery force. We've asked also, how do you see around the corner and anticipate what is next in the fast-moving science around COVID-19? We answer by assembling the brightest minds for a scientific advisory council. And now we are asking, how do you balance the need to reopen society and the economy with the public health and safety of millions? These are the kinds of questions you will face in your careers, and the answers will not be found in a book. You will need flexibility, creativity, and innovation to adapt to any situation. Throughout my career, I've been fortunate to work with medical leaders and traveled to 145 countries to help preserve the physician-patient relationship. In each place, I have seen the beauty of similarities and adapted to the differences. What unites all these diverse experiences is there is a fundamental purpose the same. It is about the mission of saving lives. With public health expertise in growing demand, you are going to have many choices about where to work and how to spend your time in the years to come. You may be tempted to pick the job with the biggest salary or the most impressive sounding title. And yes, there might be times when that choice makes the most sense for your long-term goals. But as you weigh all the options that are sure to come your way, I want to urge you to pick opportunities that let you fulfill the mission you were made for, and that is serving communities and saving lives. When you decide on that basis, you will never go wrong. Staying true to yourself and that purpose of service keeps you resilient even in the most challenging times. You will draw strength from being in the position that gives you the greatest opportunity to serve. One other thing, part of career choice is picking the people who will surround you in the job. This is so important, and too often young professionals overlook this in favor of concerns like salary, titles, and location. Always look for bosses, mentors, and colleagues who will challenge you, support you, and help you learn and grow in wisdom. And at the risk of sounding a little too personal, I will suggest you should also consider looking for those same qualities in your life partners. I've seen mediocre people rise, or brilliant people never achieve their potential, given the people they share their lives with. As you take the next steps in your journey, you are entering an exciting field at a time of profound and rapid change. This historic moment calls for what you uniquely bring as public health professionals. You are especially trained to build and assure the conditions for healthy and equitable societies. The world needs you, which means you are going to have to stay strong. We need you to be resilient. To review, here's what it takes based on my experience. Recognize that crisis presents opportunity and embrace the challenge as a gift to grow. Understand that some of the important lessons are not learned in books and adapt to the situation. Stay true to yourself and find happiness in your mission of saving lives. To conclude, today we celebrate your accomplishment and look to you as future public health leaders. We know you will succeed because of your great preparation at NYU and in New York City. So, congratulations, class of 2020. Now go forth to make the world a better place.